I'm Joe Caselli. My topic is going to be the treatment of aortic pathology with the ThoraFlex hybrid device and its relay extension for extensive pathology of the aorta. These are my potential disclosures. I think it's important to point out that transverse aortic arch pathology rarely is isolated and frequently includes downstream descending thoracic and thoracoabdominal pathology. This is recognized by the vascular domain of EACTS, where they point out that the frozen elephant trunk technique should be considered in patients with extensive thoracic and thoracoabdominal aortic disease when a second procedure, either open, surgical, or endovascular in the downstream aortic segments, can be anticipated, otherwise planned. So we're going to talk about the ThoraFlex device, which is a single Dacron and endovascular device that comes with 4 branches as the plexus and only 1 branch for reperfusion in the antiflow, and it can be 10 centimeters or 15 centimeters in the endovascular distal segment. It's employed under circulatory arrest down into the descending thoracic aorta. There's a collar for a distal anastomosis, and then the vessels are reattached either with a plexus device with the multiple branches or as an island with the antiflow. So it's very useful to extend the total aortic arch into the descending thoracic aorta, and it was approved in April of 2022 for the United States. If the distal anatomy is such that you can get a seal with the 10 or 15 centimeter endovascular segment, it can be done as a single stage, but more commonly, you have, as shown in these diagrams, a situation where the endovascular stent just doesn't treat the pathology and it requires an extension. Here with 2 devices in fusiform disease, and here in these diagrams in aortic dissection. This is an actual patient from our clinical trial that we did. We used the plexus device and a 10 centimeter endovascular portion, and we brought this patient back in short order and extended the device with 2 additional endovascular stents down to just above the celiac axis to get an excellent result. If you look at the clinical trial, 41% of the more elective cases had planned extension within less than one year, and we'll discuss these. Of the 22 endovascular second stage completions, mostly 2 stents were used. However, 6 patients received 1 stent and 1 patient received 6 stents. The types of stent grafts are shown here, and they were Gore, Cook, and Medtronic. Interestingly, 4 of the remaining 26 planned second stage repairs were done as open repairs. And so there's been interest in using the same material, construction, and device for extensions. And as a consequence, this would be, the recommendation would be the Relay Pro NBS, which, as I might mention, has no open web wires and has a 20 millimeter versus a 13 millimeter apposition built into it. And to evaluate this, there's the Global Extend study, and this will include up to 55 centers in Europe and North America with 2,200 patients and follow-up for 10 years, and at least 65 will have this Relay Pro NBS. And it is a prospective, multi-center, non-randomized, single-arm trial. Of the 41% that underwent planned extension with 1 year, it's important to note that half of these were actually done with 4 months, which when you compare to classic elephant trunks, this is an improvement. So it's a possible advantage over the classic, and that the stages can be shortened in time and with the endovascular repair, and consequently it has the anticipated benefits of that. If you look at and include the emergent cases in the IDE study, it was actually 49% had extension intervention. And this particular device is a low-profile sheath, and it's fully covered proximal stent without open wires. Now, the open wires were evaluated by the company, and during non-clinical bench testing, the distal extension devices with proximal bare stents in a supported overlap region, at what would be required in this situation, showed a risk of compromising the integrity of the primary device fabric. Consequently, the elimination of the open wires. So the platform facilitates extended repair for complex disease. The no bare stents are a reasonable approach, and they're going to be evaluated with this extend trial over the next 10 years. We'll have more information shortly. Thank you for your attention.